Everyone right to go? There are 80 active cases of coronavirus in Victoria, with 2 new cases since yesterday. Both of these 2 new cases are close contacts of other positive cases, were quarantined at home and are no risk to public health. One case was reclassified that was a false positive. I am sad to have to confirm that there are 2 further Victorians who have passed away, one male in their 70s, one male in their 80s. These are not recent deaths, they are from some weeks ago. I don't have the exact dates, but I will make sure that that is provided to you once we have the Chief Health Officer's Chief Health Officer's media release later on today. Both of those deaths are linked to residential aged care. We send our condolences to those families, of course, and wish them all the best at what will be a very difficult time. There are just 3 Victorians in hospital due to coronavirus at the moment, and none of those 3 are in intensive care. A total of 3,106,653 test results have been received since the beginning of the pandemic. That is some 24,673 test results since yesterday. That is a massive number, and I want to send a very big thank you to every single one of those nearly 25,000 people who went and got tested. This is critical. If we have a complete picture, if we know that you've got it, then we can make sure that you don't spread it. That's the absolute key. I know it sounds a bit counterintuitive, but we want to find the cases that are there so that we can wrap support around you and make sure that you don't unknowingly give it to anybody, whether it be people you love and live with or people that you've never met. By coming forward and getting tested as soon, I mean within hours of you registering symptoms, not waiting a day, not waiting at all, going and getting tested is arguably the most important thing you can do. With those results, then we know where the enemy is, we can fight the virus, we can stop its spread, and we can support you and your family to make sure you've got everything you need and that your health is an absolute priority. Helps your family, protects your family, and protects every single family. I can't tell you how pleased I am to 24,673 tests. That is a huge number, and we're deeply grateful to everybody who came forward and got tested. There are 6 healthcare workers who are active cases. The rolling 14-day average to 27 October is Metro 2.7, Regional Victoria is 0. Cases classified as unknown source or mystery cases, there are now just 3 mystery cases, and they are all in metropolitan Melbourne. That is to say, there are no active cases in regional Victoria, so those 2 from the Golden Valley who have been doing the time they need to do in our numbers are now free and clear, as it were. But I just did want to make the point that whenever there's an outbreak, we remain in contact with people for 28 days just to see if there's any support that they need, anything we can do for them. This is not a good thing to get. No Victorian should take lightly the prospect of getting this virus. We don't know everything about this virus. When science talks about a novel virus, it's basically just a short form of saying we don't know everything we should know and need to know about this virus. We've not seen this before. And there is significant international evidence that this is not like a common cold. It can, for some people, linger. It can have lasting health issues. And of course, we know tragically, this can, for the vulnerable, and indeed some healthy people, be absolutely fatal. So that support, that ongoing support, is very important, and that's exactly why we remain connected to those people who've been part of an outbreak for much longer than the time they are in our numbers, if you like, long after they've dropped out as active cases. We're still there if they need us to provide support and care. There are now just 3 active cases in residential aged care, and of course that is of very significant importance given the vulnerability in that industry. It is very pleasing to see so few active cases in that setting. Now, I just want to talk a little bit about the reopening of retail and hospitality. Today, some 16,200 retail stores, 5,800 cafes and restaurants, and about 1,000 beauty salons and 800 pubs can reopen their doors. That's around 180,000 workers who can return to work on site. That is an achievement that every single Victorian should be proud of. I want to thank everybody in all of those industries for the very productive way in which they have and continue to engage with us. They know and understand deep down that that we've all got to be COVID safe. We've all got to follow the rules to protect staff, to protect customers, but also to protect this fragile thing that we've all built, this precious thing that every single Victorian has built. So we're grateful to all of those businesses. They've been through a lot. We've tried to support them as much as we can, and now the greatest support is for everybody to remain vigilant so that we can be COVID safe and open, find that COVID normal, and then lock it in. But it's no small thing to have 180,000 people going back to work today. Many Melburnians will be keen to get out and spend some time and spend some money to support their local businesses. I would just remind everyone that the rules still apply, and the rules, they're not against you, they're for you. They are so that you can continue to do these things. That's what the rules are there for. And we can keep going, opening up further, making further announcements on the 8th of November, and then further announcements beyond that, and have that Christmas that we're all longing for, where we can be close to the people that we have missed the most. That's our aim, that's where we'll get to, but everyone has to play their part in that. I just wanted to give a very special shout out to a group of people that have probably not got the recognition that they are fundamentally entitled to, and that is our shopping centres. They've hosted testing sites, in particular Westfield and vicinity shopping centres. They've done an amazing job in making it as easy as possible for people to get tested. Those drive-through sites, they've kept them going even though large parts of their business have been closed. So to Vicinity and to Westfield, I say thank you very much. You've done a great service for the public health and the safety of so many people, and we wouldn't have got to this point without the critical role that you've played. We're very grateful to Vicinity and to Westfield shopping centres. If you have symptoms though, as I've said literally thousands of times, and I will continue to say it because it is so important, if you have symptoms, please go and get tested as soon as those symptoms are clear to you. There will be opportunities, of course, as people are out and about more, to go and get tested at one of these shopping centre sites or another site. I know this, I don't want to be anything other than clear. We did, a while back, we did see a circumstance where some people would go and get tested and then they would go and do their shopping. I would just say to people, if you've got symptoms sufficient to get tested, then the only thing to do once you've had the test taken is to go home and to wait until the results come through. Now, the testing commander will be able to speak in a moment about our testing performance, the total number of tests we've had over these last couple of weeks, and a big improvement. It was already very high, but an even better, an even higher percentage of tests that are coming back within that 24-hour period. And of course, many are well and truly ahead of that. It is very important if you get tested as soon as you need to, as soon as that scratchy throat or runny nose or fever or headache is clear to you. You can't then go shopping while you wait for your test results. You can't go anywhere. You've got to go home and you've got to wait. If that means that you're out of pocket, there are payments. If you haven't got sick leave to fall back on, then there is a $450 payment while you get tested, and there's a $1,500 payment if you're positive and you're without work for those 2 weeks. Those payments are very important, and we will pay them quickly, so that if you're protecting other families by not moving around, spreading the virus, we will protect you and support you so that no one has to choose between their bank balance and feeding their kids and keeping everyone else's kids safe. That's not a choice anyone should have to make. And with the payments that we have in place, no one needs to make that choice. And there's further information about that, of course, on the website. Just finally, a couple of other, not so much clarifications, just I think important additional information, particularly for that hospice sector. I'll read this out because the words are important. It'll of course be on our website, and we'll push this out to all of those venues. You would all remember that from midnight last night, those cafes and restaurants and bars, provided they meet the 1 to 4 square metres, they can have 2 groups of up to 10 inside. They need to be in separate spaces. The following words talk about what a separate space is. So I'll just read that out so that people are clear. Each area must be separated into discrete areas of the premises, which are sufficiently separated from any other areas of the premises. Temporary walls or structures can be used to separate indoor spaces. Walls separating areas should either reach from floor to ceiling or be at least 2.1 metres high for the space to be considered sufficiently separate. So it doesn't have to be a wall, it can be a temporary structure that separates those spaces. The main message here is we can't have 2 groups of 10 that kind of de facto become one group of 20 because they're not sufficiently far apart that they are essentially at the same gathering in the same space. Inside is 20 times more dangerous than outside, and it's really important that we have those spaces separated. But common sense is an important part of that. It's not the physical barrier as much as it is keeping people apart. So a temporary structure will work, and we'll work with the industry around how that works. But I'm sure that'll be welcome news. It's not a wall that you need. It's not a separate room. You can separate within one space using a temporary structure. I'm very confident that will be good news for the hospitality sector. Of course, COVID-safe planning is very important in all of these settings. I had a conversation with the Managing Director of Wesfarmers this morning. They've had about 100,000 people register online to go to some of their retail outlets. I understand there were many people at various Kmart stores at 12:01 this morning, probably buying Halloween costumes and things of that nature, and other critically important things. But I would say this works best always when there's a strong partnership, and if I can thank Rob Scott and his team, just as one example, but they employ many people and they have many hundreds of thousands of customers. They're very pleased to be back at work, and I'm pleased that they're doing it in a COVID-safe way to best practice standards, in fact probably exceeding any standards anywhere in the world. That pre-booking arrangement is a very innovative way of doing things. And again, I think the fact that many people have done that makes the point really clearly that people are prepared to do things they've never done before. They're prepared to go take an extra step to make sure that it's safe, because they know and understand that they've built this. You have built this, and everyone across the community has an investment, a fundamental investment, in making sure that this works. With sympathies, of course, to those two families, which is not from today, it's from a little while ago. I would just say today is a positive day. To have just 2 more cases and to have them contained, to have them close contacts that were locked away, they were away from other people, they were doing as they'd been asked, and we're very grateful for them. We wish them well, but that means that the system is working very well. And if we all play our part, it will continue to work well. And yes, there'll be cases, and yes, there'll be outbreaks, but we'll be able to live with this, and we'll be able to keep people safe, but keep the place open. That's what we're aiming to do. Can I now ask Jerome, who's doing an outstanding job leading a very big team, delivering that sort of a test result, because it is a partnership. We need people to come forward, but we also need all of our workers and our laboratory team, everyone to work and play their part, and they are. I'll now throw to Jerome just to talk a little bit about our performance over the last couple of weeks, and then we're happy to take any questions you have.
Thank you, Premier, and good morning. Over the last 2 weeks, we've seen over 208,000 Victorians get tested across Metro and Regional Victoria. 46,810 Regional Victorians got tested. That's a 48% increase on the previous 2-week period, and 161,000 tests across metropolitan Melbourne over the last 2 weeks. Again, 12% up on previous fortnight. I just wanted just to stop and recognise in particular the ongoing efforts of Regional Victorians to keep getting tested. So Premier says we now have no active cases in Regional Victoria, but we've still seen a really strong performance of many Regional Victorians across the entire state coming out to get tested. And if I look at the distribution of tests from the west to the north to the east, it's actually been a very consistent performance, and we're very grateful to every single Regional Victorian who continues to be alert for the signs of COVID, who continues to watch their own health and ensure that they go and get tested at their very earliest symptoms. And it's that kind of performance that we all need to maintain this really steady performance of minimising our cases as we go forward and as restrictions ease up. For every single positive case we found in Regional Victoria in the last 2 weeks, and of course there haven't been many of them, only 3, 5,951 tests have been done. Within the metro area, it's about 1,500 tests for every single positive case. But every single negative test result tells us something more. It tells us where the virus isn't, and it gives us a really good understanding of who's coming forward, what the geographic spread is, and where we need to keep searching to detect and control this virus. And as we've seen today, 2 more positive cases. Those 2 positive cases are both within existing close contacts. We're aware of them, we're aware of their families. They have been isolating over the last few days since they were first identified as close contacts, and they're of course getting the full support and wraparound care in terms of both financial support, food relief support, accommodation support, whatever is necessary to ensure that people who do test positive and those who we ask to isolate as close contacts get the care and support they need so they can do the right thing to protect themselves, protect their families and their wider community. As the Premier said, we did 24,673 tests yesterday. We haven't seen that number since early August. It's a phenomenally, really strong community performance to come out consistently across the metropolitan area, across the state, to come out and get tested. 98.8% of those tests had results within a day. It's again really encouraging to see that the systems we have behind this, the pathology labs that are working incredibly hard, the additional analyzers that we've bought over the last few months, the processes that we've improved, all the steps we've taken by many thousands of people who continue to work to this day and who will be continuing to work for many, many months ahead, are able to deliver such a sustained and strong performance. Almost 35,000 tests is a phenomenal number. It tells us so much about what's going on. A big focus for us will be to ensure that we keep people coming on. And as the Premier has indicated, if you feel you're not well, if you've got the slightest symptoms, not only do we want you to go and get tested today, you will have your result tomorrow. You won't be waiting at home for days on end, not sure what to do. You will have your result tomorrow, so you can plan ahead. So please do not delay. Get tested. We will support you to get tested. We'll support you if you're positive. We'll support you if you're a close contact. I'll make a few short remarks about the Northern Suburbs outbreak. That continues to be an active outbreak, and the two cases this morning are associated with the Northern Suburbs outbreak. We saw 4,689 test results since this time yesterday morning, all from the Northern Suburbs. They're part of that 24,000 figure. So again, a really strong turnout continuing in the Northern Suburbs as a whole diverse range of our fellow Victorians come out and do the right thing to get tested. We've now seen over 23,000 tests in the Northern Suburbs since the start of this outbreak a week ago, on Tuesday last week. So we're again very encouraged by that. We continue to work very hard to support the active cases. We now have 41 positive cases spread over 12 households. All of those are isolating and being supported, and we have many hundreds of close primary and secondary contacts that are also quarantining, and we'll continue to support them over the coming days. Day 11 testing will start in the next few days for the Northern Suburbs outbreak, so we still have, I think, a good week to 10 days of hard work ahead to make sure we support the community, that we ensure we keep going out and getting people tested, and we finally run this completely to ground. Thank you very much indeed.
When do you see a time when people might be able to stand up at a bar again and get a drink and not be seated?
Well, if you look at the experience from earlier in the year, I'd hope that we can have those venues operating with as many people as possible, being able to have a drink at the bar, as you say, as soon as possible. If we handle these next few weeks, all of us as individuals and families, if we all play our part in the next few weeks, then there'll be, we hope, very significant stability come to these numbers, and the longer we can continue to be vigilant, then the better the outcome will be. This is always going to be there in the background, but if it's at very, very low numbers, then it is absolutely manageable, and then that makes possible all sorts of different things. Numbers to increase, inside venues, outside venues, the ways in which people can enjoy all sorts of experiences, whether it's a pot at the bar or being able to sit in a bigger crowd perhaps to watch a game of cricket, and everything in between.
So you say by the end of the year is...
Oh, well, we can't be certain, but the Minister will be out to make some announcements about Boxing Day test and some other things later today. We're very hopeful that this strategy is working. Victorians are taking this seriously. They know what's at stake, and the vast majority of people are doing the right thing. And if everyone keeps doing that, if we all keep playing our part, then all sorts of things that have not been possible for months will again be possible soon.
Has the cup been finalised?
I think the Minister will speak about racing and indeed Boxing Day test later on today.
Can't give us a preview now.
No, I won't be previewing what he's going to say. He'll put it to you in very clear terms a bit later on.
Just on the stability of numbers,
Yep.
that's probably a key thing that the other states are looking at in terms of borders. Have you done modelling with these such low levels about where we could be?
No, I think modelling becomes incredibly difficult when you've got such low numbers. For instance, you can the ref rate off the back of 2 days of 0 and a day of 2 will be all over the place because the numbers are so low. So the statistics don't hold as true when you've got such a small sample. I don't think it's unreasonable for other states to wait and see how things go. We're making some very, very big changes. We're all focused on making sure those changes work. I'm confident that Victorians know and understand that it's not just something the government can do, even though it's thousands and thousands of people who are working day and night and working incredibly hard. Every Victorian has to work hard to make sure that we value what we've built. It's not unreasonable to wait and see how things go over the next few weeks, and based on that, if we all play our part, then we can get the borders open, we can have freedom of movement within our state, and we can have freedom of movement to go to other states if people are so inclined to do. But I would commend to them the holiday in Victoria if they're talking about the summer period. That'd be a great way to support those who have done it very tough.
Premier, I know you said the
hospital visits, I think they're still operating under stage 4. When will that change? Are you in discussions about that?
There'll be discussions. I'm not involved in those directly, but there'll be discussions. Those restrictions will remain in place for as long as it's safe to do so. But with so few COVID patients in hospital now, and again, we wish them the very best, those 3 people, to have nobody in ICU, and that's been a theme of recent days. That's very, very encouraging. That means less of the virus moving in our hospital system. But it's also about visitors, is about how much virus is out there in the broader Victorian community. As those numbers continue to fall, then there'll be a time when we can be, when individual hospitals can make different choices. I know it's very frustrating, but the choices are made for every single patient, and I know it must be incredibly heartbreaking to not be able to see people that you want to see and stay with perhaps for the whole day, for as long as they're in needing the care that they need. But often it's exactly those circumstances where there'll be lots of other patients quite close by who are very, very vulnerable because of the cancer treatment or the cardiac treatment or whatever it might be. So we've got to keep them safe as well. And hospitals don't make those decisions lightly. They've looked at it long and hard and made a very difficult choice, but I think the right choice. And if it was your loved one in there, you'd want that choice made. But I know it's very difficult for those who are being limited in how much they can see people who are very, very unwell. That will change, but safety will guide it.
Just on hospitals, the department says that it will release data about how many patients became infected with COVID in healthcare settings. Do we know when we're going to get that?
I'm not certain, but I'm more than happy to follow it up for you.
Premier, I know you said the other day that you're not averse to pen and paper documentation, but given the weeks we've had to prepare for reopening and the fact that QR code systems for cafes and gyms have worked well in other jurisdictions,
Yes.
Why didn't you ensure Victoria had an official QR code system in place ahead of today?
Well, there are many different reasons. We've moved to an entirely new IT platform. I see some speculation today about a system that operates in the Australian Capital Territory. That's not a system that can be easily plugged into the best-in-class system that we are building. So we'll have more to say about QR codes in the broadest range of settings soon. But you've got to build one that works seamlessly with the new IT platform that we've built that has helped us deliver these sorts of numbers end-to-end, and also not doing pen and paper long-form interviews. They're all part of an e-system, which means that everybody can see what's in that system wherever they are, in a regional public health team, at the centre, wherever it might be. I would make the point, New South Wales have, as I'm advised, they've moved to pretty much a universal QR system only quite recently, and I think that's a function of the fact that they have, because they've been open for longer and they've, if you like, they've taken more steps than we have. We'll get to where they are, but it'll take us a little while. Their numbers are now much, much bigger. It's hundreds of people in venues, not a much smaller number. So we'll have more to say about that soon.
We've been preparing to reopen for a very long time, though. How long do you think it'll be until we get this set up?
Oh, I can't give you a date when I'll make that announcement, but there's a lot of work going on and we're close, and we'll have more to say about that soon. I would just say this is an opportunity, not to be negative about it. I think it's an opportunity to say thank you to all of those different settings who've gone out of their way to build a product that works for them. Because obviously a supermarket's very different to a pub, a hairdresser's very different to a insert whatever example you want. There are lots of different settings, lots of different risks, lots of different customer experiences, and I'm confident we'll get a product that fits seamlessly into what I think is probably the best IT product anywhere in the country, and that's the Salesforce CRM product. It's important that we don't, having built a new system, we don't bolt on a QR code system that needs another system to sit between the two of them. It needs to link. that's exactly what we're building, and we'll have more to say about that soon.
Premier, just on indoor settings.
In the meantime, I'm very grateful to all those venue operators who are taking this very seriously, and will keep meticulous records, or use apps and pre-booking and all the other stuff. As I said in my conversations with Rob Scott this morning, I think even they are quite surprised about the number of people that have done that pre-booking, and it's a credit to them to offer that, and it's also a credit to the people that have used it. It's not usual, it's not the normal way to go to Kmart, but it's the safe way to go to Kmart if I can mix those two brand names together.
Just on QR codes,
Inappropriately, I might add.
Had your health department had conversations about using the ACT's tool? And then just as a follow-up, do you have any view on whether it should be a website or whether it will be an app? Because the health department yesterday wasn't willing to say whether it would be a website or an app.
I'm not in a position to be able to give you that definitive. I'm happy to try and get you an answer to that question. On the issue of apps versus websites, I'll leave it to others who are more expert in these matters, and when we make the announcements we'll be very clear about how the thing works. I think you've just got to use the best technology that you can find, and that's not always something that's off the shelf. Quite often you do go for the off the shelf product, but when you've built a new IT platform, a new system, it makes absolute sense to have the public facing elements of that, the input points. They have to be able to speak to that new system and do so seamlessly, not have to then go and build something that sits between our new IT platform, which I think is best in class, and the QR platform. This is again, I'm not an IT expert, but these are the detailed briefings that I get. We're not too far away, and we'll have more to say about that.
It is likely that the system will be developed by Salesforce.
I'm not sure whether it's developed by Salesforce, but it will be completely compatible with the Salesforce CRM product, and I think that's the best way to go. There's no good building a new system, building a new house and then not having the key to the front door. This just makes sense, and this is exactly the way to do it. If we could buy a product off the shelf or get something from another state, then we would, but I think that will be more complicated, more complex, and would potentially put at risk some of the really clear benefits we get from having built a best-in-class IT platform so that everyone can see what's going on, everyone's part of the same real-time response, and it's a digital from end to end. That's a really important part of it.
Premier, just on indoor settings, sorry Brett,
Sure.
On indoor settings, have you got any clarity for, say, cinemas and also, say, Crown Casino? I was speaking with the cinema CEO this morning, and he pointed out to me they've got no idea when they can reopen on the roadmap, and they point out that you've held a press conference in this room, a theatre, for several hundred days on public health advice, I'd imagine, or they imagine. So what's your response to that?
Well, this is a theatre, yes, but if you have a look at the number of people that are in this room every day, it's a small number, and it's basically the same people pretty much. So it's not a turnover 8 times per day. I don't want to get into a debate with the cinema industry, but if there's any deficiencies in our contact with them, or if they feel that they need to talk to us more, absolutely, I'll make sure and follow that up after I leave here today. We'll be able to get cinemas open again, just a matter of when it's safe, and with no disrespect at all to the product they offer or the experience or any of that, no time at the movies is worth putting at risk everything we've built. There'll be a time to do that. There'll be a time to do that. It just isn't now, but if they need a bit more clarity from us, I'm more than happy. I know many people in that sector, and they take these matters very seriously. They're about safety. It is something that people enjoy, and it does in fact employ a lot of people. We'll get it open as soon as we can, but if there's any deficiency there, or if they feel that they haven't got as much information as they need, I'll make sure someone gives them a call this afternoon.
Do you know if they'll open under, say, the COVID normal step?
Oh yes, I think they'll be open by then. Just a matter of how many people and durations and all those sorts of things, and distances and deep cleaning and all those other protocols, and that's very challenging. But we do know that indoor venues, particularly for lengthy periods of time, are much more risky than outdoor venues. You did see on Monday we made some announcements in relation to fixed seating for outdoor entertainment, which I think was 25% to a cap of 50. I know it seems a bit strange, but there'll be some outdoor cinema activity that'll be permitted before there's indoor cinema activity, and that's not the norm. but that's what's safe.
And what about Crown? Sorry, Brett. What about Crown Casino? Any update for when
Well,
the casino?
whether people are regular visitors to that place or whether they're necessarily supporters of that, their products, it is the biggest single site employer in the state. We want to get them open as soon as we can, but it has to be done safe. And I will just say this, in very detailed discussions with management there over a lengthy period of time, they too only want to be open when it's safe. And it's a credit to them. It is a credit to them. Now, there'll be some parts through the restaurant, the other hospo changes we've already announced, that will be open. They have quite a deal of outdoor space. I'm confident they'll use that well. And that'll be an experience and a part of the city that'll be much more active than it's been for a long time. I take it your question really does relate to the gaming floor. And again, when that's safe to do, then of course that we'll get that open. But I want to thank them and every business who've been absolutely focused on safety first. That's, open and stay open. That's the only way that we can do this.
Gym owners are saying that there's still too much ambiguity as far as they're concerned when it comes to wearing face masks. Aerobic activity, you
Sure.
don't have to, but lifting weights you do. They say that's just as strenuous in a lot of cases. Can you see why they've got some confusion?
Brett, I'm happy to concede that I'm not an expert in these fields. But if there's anybody from the peak or anybody from any individual business that needs to talk to a public health person, I'll make sure that happens this afternoon as well. There is a logic behind this. I have had a discussion, more than one actually, with the Chief Health Officer about this, and I apologise if there's any complexity to this. If there's complexity, it's only because of the complex nature of the risks within that space. We want to get them open and back as close to normal as we can. But some settings are just higher risk than others, and there's only so much you can do to decrease that risk. I know 1 to 8 is not. That's not what the industry wants, and I understand why. And I've said on more than one occasion, this industry has been very hard hit, and if they want to speak to us about further support, things that we can do, I'm more than happy, absolutely in good faith, to sit down and talk to them.
With 0 active cases in regional Victoria, does that give you latitude to bring forward more changes there to the roadmap?
Well, I think it's important to not lose sight of the fact that we've only just made some significant changes there. So 40 inside, they're a couple of weeks ahead of Melbourne, a little bit more than that actually. But we don't rule out the notion of going further again. So they're at 3A. Whether there's a 3B, that'll be based on the health advice. We don't want to have a situation where Melbourne and regional Victoria are so far apart that we can't open the border. Because if you've got more favourable settings in the regions, of course people will travel to get that. The best thing to do is we just see out this next couple of weeks. Everyone plays their part. We keep the numbers low, despite the fact we're open. We then bring down the 25Ks and the metro regional border on the 8th. And then if there's another step, like a 3B, then we can all take that step at the same time. That I think is preferable than having different rules in different parts of the state, because what that would mean is you had to keep the border on for longer, which I don't think no tourism business, and indeed families. It's not only about those issues. It's a very personal thing for a lot of people as well, be it the ability to go and see people they haven't seen for a long time.
There's been some talk around COVID compliance monitors at gyms. Would that be someone that already works at the gym, or would that be an external person coming and monitoring it?
I'm not certain. Again, I think there's probably a need for us to sit down with this industry and have a further discussion. We've got a little bit of time to try and work that through. But I don't want any sector to feel that they haven't had a hearing, or that there's things that perhaps the public health team don't quite appreciate. I know that industry will know their business better than we will. After all, they live it every day. The important thing is to have an open door and to listen and to try and find that really difficult balance point between what's viable and what's safe. And sometimes that's really obvious, other times less so. But you're always best informed when you're engaged with people. And if there's any sense from that industry that there's other points they want to make, I'm more than happy to make sure that happens.
Can I ask Jerome about
Certainly.
the testing numbers in the last 24 hours? That's a huge number, almost 25,000 tests. I think you said around 4,600 were from that northern area. Were there any other areas where you saw a peak in testing? Do we know why that number was so big?
No, I think what we've seen, I think, is a real focus, obviously, over the last week or so in the northern suburbs, and I think the message is getting home to to Melburnians and to Victorians, it says testing remains our biggest single tool that we've got. That's the one thing we can all do to make sure we're doing our part to keep the virus down. So we looked at our numbers. They're fairly universal across Melbourne. They're a little bit lower in regional Victoria, but as I've said, regional Victoria has done a really good job in the past couple of weeks. So no real pattern. I expect that those numbers will probably drop off a bit over the coming days, but we want to maintain a consistency and a real strength across the whole state.
Do you think it has anything to do with the return to work, people wanting to make sure that the sniffle they have is okay before they return to work or see loved ones? Is it that?
Yeah, look, possibly. I think we are, of course, saying to employers, and last week we contacted around 2,000 employers, particularly in the northern suburbs, to ensure that employers are also looking out for their staff, because now that we're starting to open up, and the Premier's talked about the businesses that are opening up today, any staff member coming back in who's not feeling well, you must send them home and get them tested. It's again to ensure that those businesses can remain open, because if we see any future COVID cases, and we know we will, if they're associated with a business, as they were with the schools last week, we have to take swift action to close the school, close the business, clean it up, test all the staff, and that will be a swift process. But again, the last thing any business would want at this point is to be impacted by a COVID outbreak. So please, look after your staff. Make sure you brief them well. Make sure they don't even think about going to work if they're not 100%.
In terms of active cases, we've had only 38 new coronavirus cases in the past fortnight, but we've still got 80 active cases. I guess, is there a lag in clearing cases, and have we got sort of 40 odd people who've been battling the virus for a few weeks but are still considered active cases?
No, look, I haven't got the detailed track in front of me, but clearly people take around 14 days to go through their infectious period. They have to go through the day 11 test before we clear them off. There are certainly isolated cases, there always have been, of individuals who take longer to fully recover and to be cleared free from the virus. And of course, as we've seen, particularly in the households over the last couple of weeks, those kind of inter-household transmissions. So a household could be sitting with the virus for quite a long time as it ricochets through individual members of the family.
And so all those family members would be considered active even if they might have cleared the virus days
No,
ago?
if an individual clears the virus, they'll be given that personal advice that says, Jerome, you've cleared the virus and you're good to go, whilst other family members and household members are still going through either their isolation because they're positive or their quarantine because they're a close contact.
So that still doesn't really explain why we've got sort of more than double the number of cases we've had in the last 14 new cases we've had in the last 14 days. We've had 38, but we've got 80 active cases still.
Yeah, I think we've certainly got 42 cases associated with the clusters we've been looking at in the last week. Yeah.
Thanks.
Just
Any more
on
from me?
testing, Jerome,
Yeah.
I imagine there's lots of thinking in the department about how we keep testing numbers really high into the future when there's less of an awareness of active cases, hopefully, if cases stay low. What are some of the strategies you guys are looking at to encourage people to nudge people into getting tested, even when they don't believe there's much virus circulating? Will there be public awareness campaigns? Will there be new advertising on buses? What
So we've done a number of things already. So you'll recall about 4 or 5 weeks ago, we were a little bit concerned about dropping testing rates, particularly in regional Victoria and outer regional Victoria. We worked very hard with local councils to run some specialised local awareness campaigns to kind of nudge people through GP networks, through local community health organisations. So we'll continue to work very closely with our on-the-ground partners to keep people engaged in this discussion about what does a COVID symptom look like. We'll come and talk maybe next week around some of the work we're doing around surveillance testing. So we have proactive surveillance testing in a number of high-risk settings at the moment, and that's an important part for us to have canaries in a coal mine out there in those high-risk areas to make sure that if there's any trace of the virus coming back in, that we pick it up really early on. And of course, we're continuing to focus on things like sewage testing, which again is a really good early warning sign for us that there might be something afoot. And we've seen really good responses to those amber lights in a number of places.
Is there any thought being given to sentinel testing at places like GP clinics or other healthcare settings?
We'll come and talk more about that. At the moment, where our focus is, we have a number of really clearly defined higher risk industries and industries that they don't generate the virus, but we know that if the virus gets into those industries, the risk of transmission is far greater, and we've seen that over the last 3 or 4 months.
We should expect an announcement next week or sometime soon on this.
Well, we'll certainly come back and give an update next week on some of the work we're doing in the surveillance space and what those numbers are starting to look like, and how we can working with industry and other organisations to stand that up.
So you're looking to expand that high risk testing?
Yeah, so we've made a very strong start a couple of weeks ago, and we'll give an update next week on what those numbers are looking like and how that's ramping up. But it's giving us some good signs.
Can you provide us with an update on Ararat? I remember there was some traces there. Have any cases been found?
No, so we put a pop-up test in Ararat last week. We've done, I think, about 160, 170 tests in Ararat. So again, a great localised community response. We're also working very closely with the correctional facilities there to check that we haven't seen anything coming out of there. That testing operation continues for another few days, and then we'll probably close it down.
Speaking of Ararat, Premier, I'd like to ask about the non-COVID issue, the Western Highway duplication project, the Supreme Court action now. How concerned are you that may actually see the work halted completely?
Well, we've got to get on and get this road built. I made some comments yesterday, and I would just direct you to the statement that's been issued by the traditional owner group. We've moved this road to accommodate significant issues of cultural heritage. There's been court action, there's been agreements, and we have done everything that is appropriate under the agreements that we have reached with those who speak for this country. I mean, no disrespect to anybody else who is deeply interested in these matters, but it should not be glossed over. This road has been moved to take account of very significant cultural heritage issues. We continue to work closely with the traditional owner group for that country, those who speak for that country, and they have issued a statement, and I would refer you to that statement. And I'd also refer you to the fact that, if memory serves me correctly, in recent years we've had 12 people lose their life on that road. It is deadly, it is dangerous, it has got to be improved and upgraded, and that is exactly what I will get done. There's a balance to be struck here. I believe we have struck an appropriate balance. I mean, no disrespect to those who feel very deeply about these issues, but I'm pretty sure that the families of those people who've died on that road, they feel pretty deeply about upgrading this road too, and so do I. There is a balance here, and I think we have struck it, and we need to get on and get this road built.
How do you decide which Indigenous groups to listen to? Because you've said that you've consulted with the official traditional owners, but there are other Indigenous people who clearly feel very strongly about this. How do you decide who's got a legitimate view on this?
Well, I mean no disrespect to anybody who has a different view to me. People are entitled to have a different view, and within Indigenous...
You've listened to one group and you're not listening to another, though.
And within... So again, let me make the point. I mean, no disrespect to anybody who feels very deeply about these issues. But at the same time, there is a structure, there is a formal recognition of those who are traditional owner groups. That is a process that is agreed and well and truly understood. It doesn't mean that that others may not have a different view, but if we're going to move forward and if we're going to find that balance point between respecting fundamentally cultural heritage, but also getting things done, then that structure will need to continue to serve all of us. That's the view of the government. It's the view of many other governments, I think. But I think we have engaged appropriately. These are sometimes very complex issues. But again, I don't want anyone to gloss over the fact that we have moved the road. The road is not going through its intended route. It has been moved. I mean, no disrespect to those who don't agree with the position. But ultimately, you've got to call these things when you've got an agreement, honour the agreement, get on, get the thing done. That's exactly what we are doing. But I do acknowledge these are particularly sensitive and particularly emotional issues for many, and I don't expect everybody to agree. But I can't sit here waiting while that road remains deadly. I cannot sit here waiting for 100% agreement. If I did that, then we'd never get anything done ever.
Just on another non-COVID issue, is Beeline's CEO James Pinder still being paid while he's being suspended?
I'm not certain of that. I can try and find out for you. I can't comment on the matters that are being dealt with at the moment, but I'm more than happy to ask that question for you.
No worries. Your public transport minister says the evidence being led is a disgrace. Do you have a view on that?
Well, I have a long-standing practice of not commenting on IBAC matters.
Do you know why the Department of Health's website hasn't been updated? It's still showing the old roadmap.
I'm not certain of that. I will make inquiries for you.
I know you said Martin Buckle is going to make an announcement about the crowds at the MCG, but you must be pleased that the G has been locked in for the Boxing Day.
Oh, very much. Yeah, very much. That's a very important event. There are lots of other events that are much smaller and a long way away from the centre of Melbourne that are just as important, but as a sign of the success that Victorians can be very proud of, that event will be one among many. We'll have more to say about Australian Open tennis. We'll have more to say about all sorts of different events, large and small, in every part of the state. The theme amongst all of them will be twofold. One, they'll all be safe, and two, they'll all be the result of a really strong partnership between our government and people who are running these events and are absolutely and fundamentally committed to making sure that they can occur, but in a safe way, in a COVID-safe way. And we're very, very grateful to them. Very.
And as an Essendon supporter, any thoughts on passing of Bruce Reid?
Oh, well, I just say to you that there are many legends in the game, and it's appropriate that we reflect on those who've given so much to our great game, and we extend our sympathies and best wishes to family, to teammates, to those who would have regarded him certainly in the highest terms. Can I just finish by saying, unless there's anything else?
Can I just ask one more?
Yeah, sure.
Sorry, just on the hotels inquiry, forgive me if you've answered this before, but have you and the Chief Health Officer submitted the additional documents that were requested of you maybe a week and a half ago, I think?
I wasn't asked for documents as such. I was asked a series of questions that were for completeness sake, and yes, that has been submitted. And it was submitted in accordance with the timeline that the board had given me. I can't speak for what Professor Sutton has or hasn't done, but I'm happy to have that inquiry sent to him and he can come back to you.
Do you believe that there will be no additional information requested of you or any other person of interest?
I certainly wouldn't expect so, given that the questions that were put to me were in every respect about, if you like, completeness sake. I wouldn't expect, but if there's anything else that they need, that isn't a matter for me. They're the ones that are running that. It's an independent process, and if they needed anything else, then we'd be only too happy to give it to them.
And still set for November 4?
There no decision, no advice. When there's if and when that is a thing, then I'll be only too happy to talk to you about it.
And Premier, on a similar subject, you told the hotel quarantine inquiry that DHHS under Jenny Mikakos was to blame for infection control breaches in hotel quarantine. You haven't spoken to her since she resigned, saying she strongly disagreed with your evidence, and she's been very outspoken on Twitter since. Given all of that, do you believe that in hindsight she was the right person to be leading the health response to the pandemic in Victoria?
No, I'm not interested in making reflections on things that can't be altered or changed. That's in the past. What I'm focused on, Rachel and all of you, I'm focused on making sure that we can open up safely. Today's a really, again, with the greatest of respect to those families who are grieving, today is a day where we can be optimistic and positive. We've had 2 cases. They had a public health response wrapped around them. They're not a risk to public health. It's the system working well, and 180,000 people are going back to work today. That's something we should be focused on, not these other matters that we can't change, and that I really do think ask me to unhelpfully speculate or be a commentator. I'm much more interested in getting on and getting things done, and today's a really positive day, and one that every Victorian should have a real sense of ownership of and a sense of pride in. We've come a very long way, and it's all down to every single Victorian.
And super quickly, do we have a date for the budget yet?
No, I'm not here to make an announcement about the budget. When we have that date locked in, the Treasurer will make that announcement, and then he'll deliver that budget on that day, and it will be a budget, the scale, size and nature of which has never been seen, because that's the nature of the challenge we face. These are unique circumstances. It'll be a budget about confidence and investment. It'll be a budget about jobs, but not just for their own sake. It'll be a budget about jobs, because jobs mean families can have safety and security for the weeks and the months and the years to come. That's what the budget will be all about.
Why is there no date for it?
Well, we're still settling that, and that's the prerogative of the government. With winning elections, you have great responsibilities, but you also have opportunities as well, and we will make announcements when we are ready to do that.
Can I just clarify, I know you're
Last
not
one,
Brett
please.
Sutton, but can you clarify the rules around wearing masks while you're dining? Does it have to be while you're eating only, or can you have
What
them
I'm
the
going
whole
to
time?
do is I'm going to defer to Professor Sutton, and we'll get the exact words for you, so there is not even a hint of any confusion in the minds of anybody who's out there enjoying what they've not been able to enjoy for a long time. But I think every patron at every cafe, every restaurant, every staff member, every owner, for profit, for their people, and for public health, will all be out there being very vigilant today, and I'm very grateful to them. Just finally, if I can say, on testing, I was talking to a group of nurses, and they put it to me that they get tested regularly because it's part of their job, but their families are getting tested as well, and it's a real point of pride. And I think one of the reasons why these numbers are at almost 25,000 is that people know that it's a simple but a powerful thing that you can do, and that it's not right if you've got symptoms to not go and get tested. That's not the right thing to do. The right thing to do for your family and every family is to go and get tested. And nearly 25,000 people did that about 24 hours ago, and I'm proud of them and I'm grateful to them. And I just say to every other Victorian, no matter where you are, even most mildest symptoms, please go and get tested, and go and get tested quickly. And if you need support while you wait for your results, 99% of which are coming back within 24 hours, we will provide that support to you. If that's all, thank you very much, and we'll see you tomorrow.